In the wake of the Supreme Court overturning Roe v. Wade, a Charlotte abortion clinic says it is hiring more staff as it prepares to deal with a possible wave of patients.
Yeah, right now North Carolina is one of really the only states in southern U.S. with no immediate plans to ban or further restrict abortions. WCNC Charlotte's Indira Skiva joining us live now to talk about this and share how health care professionals are preparing to try to deal with this impact. Indira.
Fred, Vanessa, healthcare professionals, legal experts, they're all saying this is uncharted territory with a lot of gray areas. But they do expect to see people who can't get care they need in their state to travel to North Carolina to find it.
If we have a patient and we live in a state where we can't provide emergency care and we help them seek emergency care in another state, could we be prosecuted? I mean, these are real questions that may come up.
Duke Health Dr. Beverly Gray says health providers are facing a lot of questions and uncertainty since abortions are no longer a federally protected right. North Carolina is one of the states with no current plans to ban abortions, which means more women may travel here to seek care.
We've been hiring more staff. We're looking to secure doctors who may now be out of a job in certain states to apply for licensure here in North Carolina. We've been adding clinic days and expanding hours as well.
A Woman's Choice operates 3 clinics in North Carolina, including one in Charlotte. It says it's already receiving calls from women as far away as Texas and some as close as South Carolina, where the governor has already filed motions to implement a law restricting abortions after a fetal heartbeat is detected around the 6-week mark. According to the governor's office, that law could be implemented any day.
We have expanded. We are in a position to right now see more patients than we currently have on the schedule. So we are able to schedule more patients and see folks from out of state.
The clinic tells me they have seen an influx of people calling about volunteer opportunities. And the clinic also tells me they do have a need for that. Live in York County, Indira Esquiva, WCNC Charlotte.
Indira, thank you. Tonight on NBC Nightly News, an investigation into crisis pregnancy centers. They are all over the country, funded in part by state and federal tax dollars. And NBC News wanted to find out what they do.
In fact, NBC News' Cynthia McFadden traveled to Texas, where these centers outnumber abortion clinics 9-1. And there she spoke with 2 lawmakers from both sides of the aisle fighting for funding accountability.
When I say alternatives to abortion, what is the first thing that comes to mind?
Waste of money, waste of taxpayer dollars, lack of accountability, and actually no metrics that indicate that it has anything to do with averting abortions.
This is one of the programs in the budget that there's just so little accountability. There's no real metrics. Like, how do we know this money averts abortions? How many abortions have been averted? We don't have that data.
Now, the centers do provide free services like ultrasounds and STD testing. But if you'd like to learn more about what happens inside, NBC News sent 2 producers into these centers to ask for pregnancy counseling. Hear what they were told next on NBC Nightly News, right after our newscast.